Hey all, here's the mother chest x-ray that I posted. And what this is, it's pretty simple, but we'll go over it. It's called a continuous diaphragm sign. We'll get to that here in a second. So let's read this chest x-ray like we read every chest x-ray so I don't miss anything. So we start off with A for airway. You can see the airway coming down here and branching. Looks like the carina is about right there. Carina. And it's midline, not shifted, so it looks pretty good. The clavicles, of course, if you need to make sure that the x-ray is a decent one, and they look to be pretty much in line. And of course, it's a supine film, which is important to know. B for bones. And if you go down, I always go down the edge of the ribs first, because fractures tend to stand out. They're better on AP and PA films, and they look good. The posterior ribs, I don't see anything. Anterior ribs, I don't see anything. Go up the clavicles, they look fine. And the scapula, you can see the outline of the scapula coming down, and they look fine. Outline of the scapula, and it looks fine. So that's B for bones. Let me erase these just because there's so many marks now. Now, this is a really interesting x-ray though, which we're about to get into. So C for cardiac silhouette. You see the cardiac silhouette coming down here. And it looks fairly normal. Oops, my drawing kind of sucks. And D for diaphragms. So here's the diaphragms. We start with the right diaphragm. It looks pretty normal. But then here's left diaphragm. But then you can see that the diaphragm straight across here too, which is not supposed to be. Let me erase that. As well as this here coming down a lot further is kind of suspicious. So this is what's called a continuous diaphragm sign, and it's indicative of a pneumomediastinum, which you need to, I would get a CT on this patient afterwards if I saw a chest x-ray like this, because the mediastinum up here isn't really showing that it's widened, or I don't really see any air, but you do see that continuous diaphragm sign. I'm going to show you a regular diaphragm, what it looks like on chest x-ray here. Well, I'll have to deal with this. You can see here the diaphragm on the second picture is, you can see the spine, but nothing else there. And that's how it should be, instead of having this pocket of air, which is why you can see it and call it a continuous diaphragm sign. So it tells you there's air in there. Hope you all enjoyed it. Short one, but important one, and enjoy.